vascular access for home hemodialysis. For you to have hemodialysis, HD, we need access to your bloodstream to connect you to the dialysis machine. This is called vascular access. Vascular access means access to a blood vessel. The three different types of vascular access for HD are an AV fistula, AV graft, and hemodialysis catheter. AV stands for arteriovenous. It means a connection between an artery and a vein. A fistula is made when a surgeon joins a vein and an artery in your arm in a small operation. A fistula lets more blood flow into the vein. This makes the vein strong, so 1 or 2 needles can be placed in it for dialysis regularly. Most people having HD at home have a fistula. This is because a working fistula is the best type of long-term vascular access for dialysis. Blood can flow more quickly from a fistula than other types of vascular access, so more blood can be cleaned during dialysis. But not everyone on home HD can have a fistula. If the veins in your arms are too small, an artificial vein called a graft can be placed in your arm by a surgeon. If dialysis is needed quickly, or if you can't have a fistula or a graft, a flexible tube called a hemodialysis catheter or line can be put into a large vein, usually near to the heart. A catheter is only usually intended for short-term use because it can damage the blood vessels, become damaged or blocked itself, and can carry infection. But don't worry, you can still have hemodialysis at home if you have a line. If you have a fistula, the Home HD team will show you how to insert the dialysis needles into your own fistula. This sounds scary to some people, but it's quite simple to learn. Most people say that they actually prefer to insert the needles into their fistula themselves. A lot of people on Home HD insert special blunt needles into their own fistula. This is called the buttonhole technique. The blunt needles are put in exactly the same sites in the fistula every time. It works like piercing an earring hole. Blunt needles help to keep your vital blood vessel access for longer. People say the buttonhole technique is quite easy and it hurts a lot less than the sharp needles usually used for people having dialysis in the dialysis unit. Depending on the type of dialysis machine, some people have HD at home with 1 needle and some people use 2 needles. Taking care of your fistula, graft, or HD catheter is very important. We often call your vascular access your lifeline. To keep your fistula or graft working well, you should wash your arm every day and before every dialysis treatment, not wear a watch or tight clothing over your fistula or graft, not use your fistula or graft arm for blood pressure checks, or have blood samples taken from it. If you have a fistula, you should check the pulse or vibration every day. A vibration is normal. It's due to the flow of blood through the fistula. You are less likely to have problems with a fistula compared to a graft or HD catheter, but problems can still happen. You should know how your fistula looks when it's healthy and if you get problems, like signs of infection, like pain, redness, or swelling, or if your fistula feels hot, bruising or bleeding from your fistula, if your fistula is no longer vibrating or buzzing, if your fingers become cold or painful, or if you get tingling in your fingers. You should tell your dialysis nurse or doctor straight away. If you have a HD catheter, it's important to keep the area around the catheter clean at all times. Look for signs of infection, avoid getting the catheter wet, and change the dressing over your catheter regularly, as recommended by the kidney team. Exercise is good for your health. If you are able to exercise, the renal physiotherapist can give you advice on how to exercise safely with your vascular access. Your Home HD team, dialysis nurse, and vascular access nurse specialist will support you during your training, during your transition to home dialysis, and all through your treatment at home. If you have any questions about the information in this video, or if you would like to learn more, speak to your renal team or visit our website.